Hello and welcome dear viewers to the informative video on tablet formulation basics and the interview questions. So in this video we are going to see the basics for tablet formulation and the frequently asked questions in the interviews for the tablet formulation. So this video is very important for those people who are going to learn about the tablet formulation and also the people who are going to attend the interviews. So the interviews might be in the production department, might be in the quality control department, might be in the quality assurance department and R&D department. So tablet formulations questions are always asked. We will start the questions from the basics. What are the common granulation techniques for tablet formulation? So granulation is a process involved in the manufacturing of tablets and also capsules. So tablet formulations are made by three technologies. Mainly these three techniques are used very widely. So first is direct compression, second is wet granulation, third one is dry granulation. Direct compression involves shifting, blending, compression for the tablets. Wet granulation may be aqueous or non-aqueous. Whether you are using water as a granulating solvent or the solvents, organic solvents like IPA, acetone, MDC for granulation. Based on that, it may be aqueous or non-aqueous. So another is based on the equipment for granulation. So the equipment may be RMG, that is rapid mixer granulator, or it may be fluid bed processor. So fluid bed processor granulation is known as top speed granulation. Then dry granulation. Dry granulation doesn't involve the use of any solvent, and dry granulation has two important types like roller compaction and the slugging. So three techniques are there which are used widely in the pharmaceutical industry. Those are direct compression, wet granulation and dry granulation. Another question is what are the factors affecting hardness? So hardness is the in process test. Also hardness is very important for processing of the tablets and the manufacturing for performing the manufacturing steps like coating and packaging. So the factors which affect mainly on the hardness are the composition related, which may be API properties, excipient properties, binder level, blend loss on drying and moisture level, and the blend particle size distribution. So some APIs will have good compressibility while some will not have that much compressibility. Some excipients have plastic deformation characteristics, some have elastic deformation characteristics. Based on the excipient properties, the hardness levels are different. Then process parameters are machine speed, compression machine speed, and the compression force. If you increase the compression force, the hardness may get increased. Then another question is what are the factors affecting DT time? So as we have seen the factors affecting hardness, the same terminologies are here. API properties like solubility, excipient properties and their solubility, binder level, disintegrant level, coating level, blend LOD, moisture level and blend PSD affect the DT time. As the hardness has impact onto DT, the same effect of compression force and machine speed can be expected for disintegration time of tablets. Then what is the DT time for tablets? So generally uncoated tablets have 15 minutes, not more than 15 minutes as a DT criteria. Film coated tablets will have a DT time of 30 minutes. So it differs a little bit from applicant to applicant and from pharmacopoeia. So these are the generalized DT times given here. Then classify the tablets based on the coating. So tablets may be uncoated or tablet may be coated. Coating may be film coating, enteric coating or multiple coatings might be there. Like seal coat, enteric coat, again the Popa dry coat or again the film coat. Then tablet might be sugar coated and also some of the tablets might be extended release coated. So those are known as ER coated. Then which granulation doesn't involve drying stage? So the example of granulations are direct compression and dry granulation like roller compaction and slugging. These two techniques doesn't involve the use of drying as this doesn't involve the use of solvents. Why granulation is done? What is the reason for doing the granulation? The granulation in the pharmaceutical industry is done for tablet formulation to improve the processability of API and the raw materials. If the API and raw materials are easily processable, they have good flow, good compressibility, then you can go to direct compression process. And if some other things are required like densification, flow, content uniformity, and the tablet properties like hardness and the disintegration, that time granulation is done. Not all the materials are processible, not all the materials are compressible, so granulation is done. Granulation is also done to improve the bioavailability of some of the molecules as these drugs are dissolved in the binder and then granulation is done. So these are some of the reasons for performing the granulation. Now name the granulation equipments. So based on the granulation technologies, fluid bed processor is used for top spray granulation. Rapid mixer granulator is used for aqueous and non-aqueous granulation. Then roller compactor is used for compaction and dry granulation. And for slugging, the compression machine is used. Then planetary mixer gives the low shear force to the material, and that's why that granulator can be used where the shear force is not required. The rapid mixer granulator gives higher shear while the planetary mixer gives low shear. Name the tablet components, that is composition. What is the generalized composition for tablet formulation? So first is API. The API may be 1, 2 or more based on the composition and the label claim. Then diluent, binder, granulating solvent, disintegrant, glidant, lubricant, any other material as ER polymer and the coating materials are there. Generally the coatings are HPMC based and the polyvinyl alcohol based. The 10 number question is how the tablets are manufactured by direct compression. Direct compression is the most easy and involves the less processing steps. So first is shifting of raw materials, blending and lubrication, then compression followed by coating if the tablets are coated. Then packaging is done. How the tablets are manufactured by roller compaction or what are the steps for roller compaction? So similarly here also shifting of raw materials, blending and lubrication. So blending and lubrication is done before roller compaction, that is known as pre-roller compaction, blending and lubrication. Then roller compaction is done for getting the granules. Desired fraction of granules and fines are taken. Milling is performed. Sometimes the roller compaction has the integrated milling unit. Sometimes it may not have. So based on that, the roller compaction and milling is done. Then the extragranular materials are mixed with the dried granules with the uh, roller compacted granules and the fines. Then lubrication is done. This is known as post RC blending and lubrication. Then the blend is ready and that is compressed. If the tablets are film coated or if coating is required, then coating is performed. And the final stage is packaging. How the tablets are manufactured by wet granulation. So wet granulation involves the use of solvent. The number of steps are more and solvents are required. That's why drying is also required. Shifting of raw materials is the first step, followed with mixing in RMG or fluid bed processor, binder preparation and granulation with the binder, then drying of the wet granules, shifting milling of dried granules, blending lubrication followed by compression and coating, then the tablets are packaged. How the lubricated blend is characterized, or what are the in-process tests for lubricated blend. Lubricated blend preparation is done by the granulation, and that lubricated blend is taken to the compression area for compressing it into the tablets. So description: BDTD, that is bulk density, tap density, particle size distribution, blend assay, blend uniformity, and LOD are the test for lubricated blend. Another question is how the tablets are characterized. So tablet formulation is tested in QC for the below test like description, assay, disintegration, dissolution, related substances or impurity profiling. It is also known as organic impurities testing, and water content. So based on the formulation type of tablet, these tests may be more in numbers. Then the another question is how the tablets are classified based on the release rate. So based on the release rate, you can classify the tablets as immediate release, delayed release. Delayed release is also known as enteric coated or gastro-resistant tablet. Extended release, sustained release, or prolonged release. So these terminologies are there for release characteristics of the tablet. What are the in-process tests for tablets? Tablets are compressed and their in-process testing is done for description, weight variation, DT time, that is disintegration time, hardness, thickness, and the friability. These tests also vary with the tablet formulation type. Then another question asked in the interviews are what are the problems in compression, or what are the compression defects for tablet formulation. So these are weight variation, that means the weight is not uniform, it is varying from tablet to tablet, that may be because of the improper flow. Then another is capping, sticking and picking, lamination, cracking, chipping, mottling, and double impression if debosed tablets are there. So you can find the elaborative information on the all these defects and their remedies. Double impression can be avoided by using the tooling with keys. So this is the remedy. Then what are the problems in coating process? So shade variation is there. Generally coating involves the color in the composition of film coating, and if that distribution is not proper, then shade variation may happen. Then orange peel effect is there. A rough surface of the tablet is there. Logo filling and logo bridging. Ununiform coating. Ununiform coating means some of the tablets are getting coated while other are not getting coated. Then is twinning and edge erosion. If the tablet are not sufficiently hard, then edge erosion may happen during the coating. What is sticking and picking and how it is avoided? So this is very generalized and very important question. So sticking is the sticking of granules or blend to the punch tip during compression. Picking is for those tablets which have embossed toolings or when the tablets are debossed. So picking generally happens nearby that embossed area. And the reasons for sticking and picking are high LOD or moisture level of blend or granules, and that may be because of improper drying or improper LOD level, low lubricant level, and improper lubrication. If lubricant is not sufficient, it may give rise to the reason of sticking and picking. API properties: too sticky, too much fine, or low melting point APIs. Whenever you are going to use the API in the formulation, and if it is more than 50-60%, then these things may happen. Some APIs may have low melting point, some APIs may be sticky in nature, and that's why sticking and picking occurs. Sticking picking occurs also due to the tooling problems. Then sometimes sticking occurs due to high or low binder level and hygroscopic nature of the blend. Then is tablet tooling. Generally this is asked, what are the tablet tooling types? So generally two types of tablet toolings, three types of tablet toolings are used in pharmaceutical industries. These are D type, B type, and BB type. So based on the tablet size, these toolings are used. D tooling is used for big size tablet, while B and BB toolings are used for small and medium size tablets. Multi-tip toolings are used for small size and the mini tablet formulations. And multi-tip toolings can compress the more number of tablets at a single compression. That means instead of one punch, there are multiple punch tips in the same punch, and that's why these toolings can give you the multiple tablets at a single compression. So this is regarding the tablet formulation. Tablet formulation topic is a very vast topic and it cannot be covered in the single video. So multiple videos will come on the tablet formulation. This video is very important for the students studying in the pharmacy and also for the persons who are working in the industry and for the people who are going to appear for the interviews. So always have good understanding about the topics so that when your interviewer asks you the question, you can easily answer those questions. Thank you for watching the video and let's meet you soon with such kind of informative video. Thank you.